Hello YouTube, welcome back to my channel. It's TSP here. If it's your first time here, please drop a like. If you've been here before and you're back, please subscribe. Today is going to be a little different, so I'm going to give you a little bit of update on what's been going on with my hip. So I actually did meet with my orthopedist, I believe it was either earlier this week or last week. All the days running together at this point. But I met with him and we talked about the fluoroscopy that they did with the injection and how I'm doing a lot better in terms of pain, and I'm actually able to sleep with the amount of pain that I have at this point. But it looks like the next step, we're avoiding surgery at this point, and it looks like we're going to be going to physical therapy. So today, I thought I'd make this video because I've started physical therapy, and I started physical therapy actually today. So I met with my physical therapist and he started doing an evaluation to see some of the things that were going on within my hip, and it looks like overall things are functioning decently. There were some weaknesses in my quads, and then my hamstrings are too activated, too strong compared to my glutes, so it looks like there needs to be some rebalancing of that as well. And they gave me a bunch of activities, exercises to do, and I've been doing a lot of those. So I've kind of made a renewed focus on overall health and physical functioning. So I've actually started going to get regular massages, going to a massage therapist, and I started doing yoga in order to increase flexibility along with strength. And so a lot of the exercises that my physical therapist suggests that I do are things that I'm doing actually in the context of the yoga that I've been doing to hopefully increase some flexibility and get some flexible strength back into my body. So we'll see. I'll continue to do what I've been doing and increase into doing those exercises daily, as I wasn't doing them as frequently. I'd also already been doing some physical therapy myself, so YouTube is a great resource for a lot of information. So I was using some of the information I found to do a lot of physical therapy type exercises, strengthening exercises and stretching. And I think that those actually have been helping because I've been doing those for quite some time now. I've been doing those for a couple of months, and I didn't tell my physical therapist that, so in retrospect I probably should have done that and let them know that I was actually working on all of these things. And but we'll go from here. One thing that is kind of saddening / frustrating for me is that he wants me to kind of step back from some of the exercises and workouts I've been doing. So I just have gotten back to squatting probably in the last month or so, and now he's wanting me to take another week or 2 weeks off again from squatting. And I've been building my strength back up to be able to do multiple sets at a decent weight that I was able to do before at 315. So I was kind of sad about that, but when I look at it and put it in perspective, it was several months that I was not squatting at all because of the pain I was experiencing in my hips. So another 2 weeks isn't that big a deal. It's not going to set you back as far as 3 to 4 months was. So we'll see. So I'm going to abide by what the physical therapist says at this point, and we're going to go from here. So if things don't get better in the next couple weeks, then we'll go into physical therapy in the clinic probably every week, working with physical therapists. But I don't know, we're just gonna have to see, and maybe we'll be able to completely avoid engaging in any type of surgery at this point, but who knows. Well, thank you for being here. This is TSP, and I thank you for joining me on this journey of mine, and hopefully you can make your tomorrow better than today.